This session is sponsored today by Intellinetics, and we would like to thank them.
Hello there, my name is Matt Cretion with Intellinetics, and welcome to the 2020 Opera Fall Conference. Intellinetics helps providers improve outcomes, safety, and service levels while reducing costs by making documents accessible, secure, and compliant. COVID-19 has amplified the cost and pains related to document management. The simple fact is, if DSPs on the front lines and the back office team providing support can't access a document that's in a locked building, that's not good. Virtual work teams require anytime, anywhere document access. Empowering you with that access, that's what we do. There's a good chance somebody you know and a friend or colleague is using our solutions. We work with many boards and providers alike of any size to implement our solutions and make information accessible, driving better results and better service performance. We have on-demand modules that meet your needs, delivered by experts that speak your language. I'm happy to say our team is expanding as well and includes Jim Enneking, the principal at Enable Services, formerly with Primary Solutions, who's helping us serve our growing customer base. He will be reaching out to share ideas and learn more about your goals, so be on the lookout. Now, the stars of our show. Our session today, COVID-19 and People with Disabilities, will be led by Christine Brown and Andrew Buck from the Nisonger Center. My daughter Phoebe, who's on the autism spectrum, participated in a groundbreaking study called Shakespeare Autism in the Brain, a study that was led by the Nisonger Center. I had the chance to see firsthand their research prowess, innovations, and education and its global impact. Our experts today, again, Christine Brown is a LEND self-advocate faculty member and clinical research assistant at the Nisonger Center. She also serves on the board for the Ohio Self-Determination Association. Her colleague and co-presenter Andrew Buck is a learning and development consultant and is currently pursuing his PhD in educational policy. It's a privilege to introduce these two speakers who will share insight and ideas in their session entitled COVID-19 and People with Disabilities. Thank you.
Well, good morning, everyone, and thank you for that nice introduction, and glad that you've been able to experience our services directly. And to everyone, thank you for taking the time to learn more about our work at the Nisonger Center. As was mentioned, my name is Andrew Buck, Learning and Development Consultant, and I believe Christine may be having some technical difficulties as she's trying to join, but we'll go ahead and get started, and hopefully she's able to join with us. As was mentioned, we'll be talking today about some initial results that we've found through a survey that was written and intended to increase self-report in individuals with intellectual and developmental disabilities regarding their experience during the COVID-19 pandemic. So taking a look at the literature, we know that research has shown that adults with IDD are at an increased risk for poor mental health outcomes, employment outcomes, as well as social isolation. So these were pre-existing problems and issues that we were dealing with pre-COVID. Since the pandemic started, research has also shown us that racial and ethnic minorities have been at an increased risk of getting sick and dying from the disease due to systemic health and social inequities and disparities throughout the system. Of course, these types of issues include discrimination, access and use of healthcare services, the types of education, employment, and income that different groups of people tend to be in, as well as issues around housing. Additional literature and surveys have been sent out to family caregivers of those who are taking care of either family members or others with intellectual and developmental disabilities. And caregivers have reported more negative effects than non-caregivers, including some of those same issues like social isolation, but other mental health worries like anxiety and depression, fatigue and sleep disturbance, as you can see as well, economic issues, financial hardship and food insecurity, additional worry about getting sick or being a vector themselves to the people that they're taking care of, as well as interrupted access to care, either for themselves or for their care recipients. Moreover, it was shown that even greater negative impacts were reported by caregivers who fit into minority categories or other categories that were considered at additional risk, either being younger, minority racial status, obviously female at the very top, having less education and lower income, caring for persons that had mental health or behavioral issues, and living with the care recipient, all tended to be complicating factors and increasing risk and negative impacts on those during this time. In addition, service providers of those with intellectual disability or autism reported greatly reduced capacity due to the pandemic. And so you can see at the top that transportation always tends to be one of the more complicated issues of providing service, and 80% decrease in individuals served during this time. We've also seen a 68% decrease in community participation supports and a 40% decrease in supported employment. Of course, another difficult and complex issue to deal with without the pandemic complicating our lives. I think, alarmingly, you see there that last April through July, there was a 56% turnover rate in comparison to the same time last year, it was at 31%. So of course, this is another big issue with very high turnover rates for these workers. And of course, the pandemic caused that to increase over 20%. Barriers that were reported by those direct service providers and why the turnover rate was increasing that much, things that were identified were the risk to their self or other household members, obviously at the top, which also feeds back into that worry and anxiety, the increased mental health concerns that we've been seeing. Others were citing wages as a reason for increasing the turnover rate, as well as needing to educate their children at home. Others indicated that they may have been at risk for complications due to pre-existing health or higher risk categories, and childcare. So with all that being said, we think that COVID-19 may have a uniquely negative impact on individuals with IDD, and led us to ask this very question of how is the pandemic impacting the well-being of adults with ID? One of the big things that we're trying to do at the Nisonger Center right now is to increase self-report measures by developing surveys in clear language and providing them through more accessible means, so that individuals with IDD are able to complete interviews and complete surveys through their own voice, and they can provide their own ideas rather than being dependent upon proxy reporting. And so while this survey was intended and sent out to adults with IDD to complete on their own, many did complete it with a support person. But I think, as you can see from all of the previous results, oftentimes we're doing surveys with family members and caregivers and direct service providers, but we're failing in many regards and across many fields to develop surveys that can gather information from these individuals and from this population themselves. And so that's been a major push of ours. And we wanted to make sure that during this very complicated time that we got that information directly from them. So we designed a survey. One of the major limitations that we will discuss is that it was delivered online. And so, those technical considerations of who has access to technology, who has the technology skills to be able to complete this, certainly did limit our sample. However, we'll get into who our sample was comprised of and how they answered some of the questions that we asked them, either independently or with support. So we had nearly 500 individuals participate in the survey. Not everyone completed the entire survey. Nearly 400 did, and also provided an email for follow-up. So we're very shortly going to be sending out a follow-up survey so that we can conduct more of a longitudinal analysis of this data and to see what changes have occurred over time. You can see nearly half disclosed an intellectual disability and a developmental disability. 30% disclosed a developmental disability. Over 20% disclosed an intellectual disability. You can see the majority of those that completed the survey did have support from a friend or a family member. 26% indicated that they filled it out on their own, and 13% indicated that they filled it out with support from either a service provider or another health professional. There's also a range of disability types or difficulties that were indicated, as you can see here. 7% deaf or hard of hearing, 10% blind or difficulty seeing, 65% difficulty with concentration, memory, or decision making, and nearly 80% difficulty doing errands alone, such as independent living skills and other community activities. About half of our sample came from Ohio, so that's our own backyard, so that makes sense. We had a great partnership in getting this out in Virginia, and we had just a few others nationwide. So mostly a dual state survey here with a few others participating in other places. Little over 50% were male, and then about 47% indicated they were female. A few other gender identities were indicated as well, as you can see. Here's where I indicated that maybe technology had some effect on our sample size. As you can see, half of them were in the 18 to 30-year-old range. And so, it was a younger sample size, but we certainly had a good group that were 31 to 45, and then a few older that were 46 or above. In describing their living arrangements, 18% described living alone, 12% with non-family members, and 4% in a group home. Over half of the sample indicated living with parents, and then just about 7% living at other family members. With regards to race and ethnicity, we've got nearly 80% of the sample is white, as well as a little over 12% indicating Black or African American, and then a smaller sample of other races and ethnicities, as you can see. So one of the first things we asked was we wanted to know who was getting county or state services before the pandemic hit. And so the large majority of those that completed the survey, over 80%, indicated that they were receiving services before the pandemic. Just under 18% said that they were not receiving any county or state services. And of that group that indicated that they were receiving services, about 85% indicated that they were still receiving services post-COVID. So after COVID began around March into April, a large majority of those that were receiving services were continuing to receive services. So we saw that, about 15% or so may have stopped receiving services, and we don't particularly understand why, but when we did ask who was having problems accessing the services, we saw a greater percentage of those, and including some of those that may have indicated that they were continuing to receive services, indicating having problems accessing them. And so if we think back to some of the earlier literature, we know that transportation services and community participation types of services were greatly impacted. And so accessing those types of services, it seems, were increased for many individuals. So this is asking then more about those that were receiving waiver services during the period. So you can see a little less, but still a strong majority of the sample, a little over 70%, were still receiving waiver services during that time. And, nearly 75 individuals indicated that they were no longer receiving waiver services. And again, maybe tying back into all of the other negative impacts across the system, particularly in the direct service provider categories. So again, this is where we might have some limitations in our data. Obviously, this was an online survey, so when we were asking individuals about their technology use, nearly 80% said that they were using technology to communicate with others, and that included video calls. As you can see, maybe surprisingly, that's the greatest category, I think, in our lives. Certainly video chats and video conferencing has become a part of everyday life and work. And so video calls were at 80%. Phone calls, 3/4 indicated that they were continuing to use phone calls. And obviously texting is up there. Emailing, not as popular. And surprisingly, social media, not as popular. How often? As you can see on the right-hand side of this slide, you can see nearly a third of those indicated that they were using technology on a daily basis, and maybe a quarter were using it 1 to 2 days a week, or several times during the day, or 3 to 5 times during the week. So obviously this sample, who completed an online survey, had access to technology and tended to be using it fairly regularly. That limitation is also indicated here, where you can see nearly 70% indicated that they're happy with the technology that they have. Some indicated that since COVID-19 began, the technology that they wish they had access to, a laptop computer, a tablet, obviously useful tools for keeping in communication through video calls and other forms, other modes of communication. So when we were asking about employment, little over 40% of the population reported having a job before the pandemic. And of those that were employed before, again, that's about 180 or so individuals of our sample, 54% indicated that they were working less hours. 50% indicated that they were laid off since the pandemic began. 42% reported that they had not received unemployment, and 35% reported that they did not find it easy to get unemployment. So I think this is one of the more alarming findings that we found, that nearly half of those that indicated that they were working lost their job. And so this is, just an important point to pause here and think about the impact on all of our lives, particularly those who might be at an increased risk of negative impacts during this time. And not only this population, but others who have struggled to maintain employment or have had their hours reduced. And in some cases, it's the opposite, where maybe they're working more hours or continuing to need to be in contact with people in those essential types of positions. So as you can see here, of that same group that indicated employment before the pandemic, nearly 30% reported still having to go into work and to be close to others, again, possibly related to the types of positions that they're in with those essential types of jobs. And 10% reported having to work more hours. So that was a rarity in this case, but a few did indicate working more hours due to the crisis. When we get into health, I think, this is kind of the crux of the survey, where we found that, in good terms, nearly unanimously, the sample reported not having had COVID-19. You can see, though, that 3% did indicate contracting the virus. 85% reported that they had not been even exposed to someone with it, or not having any knowledge of being exposed to someone that had contracted the virus. 12% reported that that they just weren't sure. And of course, I think with a virus like this, which is oftentimes asymptomatic, that makes sense, and you might even imagine that number being higher. So here's another thing that we can really learn from here. Only 60% of the sample, even though that's a majority, reported knowing what to do if they were exposed to COVID. So we can say that, nearly half, and 40% of the sample, if they were exposed to the virus, indicated that they were not sure what to do in that case. And so making sure that we're sharing information in clear language during these types of crises, and making sure that that information is being disseminated in a way that's accessible and comprehensible, is really important. And so that can be done through, local self-advocacy groups, as well as county boards of developmental disabilities, and obviously from state departments, making sure that the knowledge of what to do during emergencies is clear, concise, and disseminated effectively. 77% reported being able to get necessary medical treatment. And so that's a good sign, but also indicates that a small portion of the sample wouldn't know what to do and where to get medical treatment, or be able to get medical treatment. 80% reported being able to easily access protective gear. And so that's another good sign, but again, we can also see that there is a small gap in making sure that that those types of protective gears are available. And of course, keeping in mind with all of this, that this, even though time has really flown by here, it's already fall, and this happened all the way back in the spring, that this initial survey did take place in the early months. And so this was also during a time when protective gear may have been in short supply for many people. So that was a surprising finding, that most people had easy access. And most reported using protective gear all or most of the time, which is another good sign, and another indication that all of the information about the importance of wearing masks and protecting ourselves has been effectively disseminated. When asked about in-person providers using protective equipment, you can see that direct service providers, were indicated at over 50% using that protective equipment all of the time, 11% most of the time, 7% some of the time. 1% did indicate never, and so we were concerned about that result in that instance, but not sure if that was due to confusion or what. 30% indicated that it was not applicable, obviously not having any direct service providers visiting them in home. And keeping in mind that many of these participants also use the support of someone close to them to fill this out, including service providers but does indicate here that they are masking up. Here again is where we really need to pause and reflect on the impact. So since the pandemic, 11% reported having more health problems, but half of the survey participants reported more mental health problems. And I think we can probably all relate to this and what has been going on. When asked about specific symptoms that were endorsed by those that were reporting more mental health issues, so again, 50% of the sample, nearly 200, indicated increased mental health issues. Of that subsample, 70% of those indicated that they were worried, 66% indicated that they were stressed, and 56 indicated that they were sad. And so you can see some of the other symptoms that were endorsed of those individuals that indicated increased mental health issues. And again, this is probably not surprising to us, but having 50% indicate increased mental health concerns and over a majority indicate being sad, nervous, worried, and stressed obviously leads us to believe that we need to make sure that we're providing the care that's needed at this time to individuals with intellectual and developmental disabilities, and reaching out to them and ensuring that they're doing okay during this time, just like the rest of us. One good sign though here is that 14% indicated that the mental health treatment that they've been receiving is great, and nearly 60% indicated that it was good. We do need to be concerned though with about a third of those that said that mental health treatment was either fair, or the smaller group, 6%, that indicated that it was poor. And so obviously, there's a gap here in providing service, quality service to individuals around mental health care and mental health treatment during this time, especially considering that unique negative impact of increased mental health issues and concerns. So as we're wrapping up this presentation, I want to indicate what our next steps will be so that you can check in on us and visit us at the Nisonger Center website to learn more about how these individuals have responded to a follow-up survey now that we're many months into the pandemic, and went through a phase where things seem to normalize, where we seem to have flattened the curve. Now again, as we're seeing rates increasing, that's another issue where we don't know if we're going to see different results around employment. We tend to figure that several individuals are going to be indicating that they've gone back to work since this time, but we're really concerned about the health issues that seem to be exacerbated. So we're probably predicting an increase back to employment, but possibly a stagnant or even increased rates of mental health concerns. So we're eagerly anticipating those results so that we can make sure that we're addressing those issues by providing solutions and strategies. So we've gone through a process of reviewing these results with partners and doing a few presentations to get the information out there so people are aware of what our sample was saying, and so that they can react and respond accordingly. We've made a few minor revisions to how we ask the questions and what types of information we're going to gather. Of course, when you do a survey that tends to be dichotomous and how you answer, you have a lot of forced responses. Oftentimes that leads to a lot more questions than answers. And so, as we went through, and obviously as you went through those results, you probably had more questions pop up into your mind of what do those results mean. So we're going to try to dig a little bit deeper into some of those areas and possibly get some more open-ended or qualitative types of reports back from people. And we're going to be sending that out here within the next week or in early December. I think we were waiting for an IRB approval before we were going to send this back out to that same group that provided us their email addresses, and obviously then conduct a longitudinal analysis to compare and contrast those preliminary results and the results now that we're many months into the crisis. Several references here that we've included during the presentation for your availability, including many of those surveys that have been conducted across the different stakeholder groups, which have been very informative. At this time, I'd like to open it up for any questions you might have, or anything else that I can share with you at this time.
Sorry for that delay. I was having a little technical issue. I can go ahead and share the questions with you. One moment, please. Okay, so Michelle Horsley would like to know, why do you feel the percentage of people that live in a group home and participated was so low?
Yeah, that's a great question. You know, I'm not sure that I'd be able to answer that, and maybe I can let me deliver us back to that slide here so we can see where we indicated that. You know, the lowest percentage of those were living in a group home, and so you know, I think we can hypothesize that you know the large majority were those living at parents, and so oftentimes with that sort of direct support and being able to participate in these types of surveys, I think probably increased that percentage. Whereas maybe living in a group home, there's not that direct support oftentimes that is willing or encouraging to participate in research. You know, as we're increasing self-report measures and trying to increase participation in research amongst individuals with intellectual and developmental disabilities, oftentimes, at least from county boards around Ohio, they've been very willing to share that information with others and encourage their stakeholders to participate in research. In some rare instances, we've got a lot of pushback. In particular, one county board in Ohio said that they would refuse to use their platforms, their email listservs, or their social media to disseminate any research activities to participants. And of course, research has a long history of not always being beneficial to people, and particularly to groups who might have increased risk. And so there are a lot of issues at play here, and I think that that's a great question. It's interesting to think about. We don't know for sure, obviously, but I hope you know some of those ideas might provide some insight.
Okay, thank you. Another question we have, or a comment, Dr. Bauer said, important for DSPs to get the mental health they need. Rural, I can never say that word, rural mental health providers are few and far between. Using telehealth is a need, but some areas in my neck of the woods are a product of the digital divide, no Wi-Fi available.
Yeah, really good point. Talking of the digital divide, it used to be access to technology. They say the second wave of the digital divide is actually not only having access to it, but having the IT literacy skills to use it effectively. And a good point too, that, you know, direct service providers, as we saw in another survey, experiencing the same types of issues of worry and concern during this time, and are also at an increased risk for mental health concerns. So it's kind of, you know, as a metaphor, like the food chain effect, you know, as the system is suppressed or exacerbated in one area, that tends to have that negative effect that sort of expands itself concentrically in greater areas. And so as direct service providers are experiencing mental health concerns and having trouble performing their job, that also directly impacts those that they're serving. And so that can be even a greater negative impact and a reason for why we're seeing that. So I appreciate that comment.
Okay, let's see. Shelly Mills said, she responded to Kurt. He said that he's found that the technology does not work properly. If technology doesn't work properly, people drop off. And she said, yes, this has presented issues with virtual appointments and training or informational meetings. We plan for backup ways via phone calls or emails, but the lack of face-to-face or visual interaction can be frustrating, to say the least. Okay.
Yeah.
Here's one. Mental health for DSPs and for individuals with intellectual disabilities is troublesome. I do really like the Zoom meetings with counselors. I think it is easier for some to accomplish.
Yeah, great point. So, as this all started, and again, we look back and see the results of the majority of the participants indicated video calls as being one of the primary modes of communication that they were engaging in. At Ohio State, we're partnered with and Zoom, and we were using Zoom to provide, although now we also have the option to use Microsoft Teams. But we also developed some clear language guides to help support Zoom, getting on Zoom and just getting set up with an account or just connecting on a meeting. So again, it kind of goes back to that idea of the technology is available, but do people have the skills to be able to use it? And so we also wanted to make sure that we provided some very simple getting started guides. And of course, those are available on the Nisonger Center website if you're interested in those. I should have indicated as well, if you do have additional follow-up questions or want to gain access to any of the information that we've discussed today, you can send me an email. And that's just my name, andrew.buck@osumc.edu. And I can also post that in the chat while we're hearing any other questions that you may have. So feel free to follow up with this. I do see my colleague Christine has joined us, and just to catch her up, we've been able to get through the presentation, Christine, and now we're just addressing questions, but maybe we'll pause just so that you can introduce yourself to the group and maybe highlight, when you think about the results that we found, what stood out to you the most, or any other points of emphasis that you'd like to make to the group. Christine?
Okay, well, first, sorry for this. It just got off my track because there's been so much things going on. Sorry for that. The thing about this this survey that really I was so interested in was we wanted to see what the how people with intellectual and developmental disabilities were experiencing during this COVID-19. The Ohio Department of Health had a survey, but it was primarily focused on the working class and not people with disabilities as good. So we wanted to do something to see what was the difference in these challenges. Next slide. Let me go to this.
Yeah, so just Christine, just as a reminder, so we've gone through the entire survey. So if there's a particular slide that you wanted to emphasize, we can go back to that. Or if you like.
What about the question, the one that says, have you continued to get county or state funding services? That's what
Sure.
explain. So this one of those who
Okay, here we go.
Of those who have received county or state funding service, and then, yeah, this one, and then no longer getting services. I think sometimes some people with intellectual and developmental disabilities would think, it's, I'm just not getting services because I'm stuck in my house right now. So one thing that we're doing when we have the next phase of our survey, whenever that will be, we are gonna edit and say, if they have a case manager, service coordinator, service and support administrator, please check yes. Because some people just need it even more clear to correct and put the right answer in. Because if they say they're not getting services because they're sitting in their house, not doing anything, they think they're not getting services, but if they still have a case open, yeah, they are.
Great, thank you. I'll throw it back to Melissa to see if there were any other comments or questions from the audience.
Yes. We have disappointing that more individuals living in waiver or ICF settings didn't participate. Okay, Kurt, did you want to comment on that?
Let me pause there because someone
Yes.
else mentioned, as we go back to who participated, indicated that our lowest response rate came from those living in a group home, and as was just indicated, the sample is not including those on ICF, I believe. What strategies, Christine, do you think we can employ in the future to make sure that we're including individuals in those facilities and living situations?
Probably working with the providers who coordinate ICFs. Also, the Ohio Department of Developmental Disabilities has developmental centers and institutional setting. So if we worked with those people, we might be able to get some more response in that area.
Do you think there's other reasons why we did get such a low response rate from that particular population this time around? Was it not connecting with those organizations that you just indicated, or you think there may be other reasons? Like, one of the reasons that I thought that we had a majority of those that participated were living with their parents is because they have that sort of direct service provider that they're living with, who's also a parent or a guardian that might encourage them to participate in research. Would you think of any other reasons why those living in a group home or other facilities may not have access to the survey or the provider to support them, or what do you think there?
Well, I can't say that they can't have access all because they don't have internet and iPad always.
Mm-hmm.
Sometimes the provider has this computer, and so they could fill stuff in with the individual. So I think our biggest thing is we didn't send stuff to that sort of group this time around.
Yeah, good point. And so it could also be more directly tied to that access to technology, since it was an online survey. That could have really affected our sample as well. Thanks, Christine. Melissa, anything else?
Yes. Dr. Bauer says he has worked with people with higher functioning autism. Some people with autism do not like the ability that they can't control the conversation like they can on a video game or computer. It can work, depends on the person. This lack of control makes them uneasy. And did you want to comment on that?
Yeah, I'll have to think about that. That's
okay.
yeah, that's very interesting. but no comment at this time.
Okay.
I'm gonna let you in.
Okay, I've got one more from Shelley Mills. She commented, their routine is broken. They are used to going to day hab, going out into the community, having get-togethers, group activities. That's where they feel like services aren't happening because it's not safe to do some or most of those things at this time.
Andrew, sorry, but somebody just got here I have to go to. I'm sorry this got screwed up.
Sure. No, I appreciate you hopping on and being able to introduce yourself.
Thank you, Christine.
Thanks.
Let's see. So that was it for the questions. Did you have anything else that you would like to share?
Well, I would like to encourage everyone to please visit us at the Nisonger Center website and explore all of the work that we're doing across different fields. We have an early childhood education center that practices inclusive settings. We have a transition services department that has its own comprehensive transition and post-secondary program. We've got a health promotion and healthcare parity department, which is now modifying diagnostic health interviews to conduct with adults with intellectual disability to better diagnose mental health issues. A part of that study is also looking at developing guidelines of best practice for providing mental health care treatment for these particular stakeholders, as well as many other areas of work that we're doing at the Nisonger Center. So please visit that website. And again, if you want to stick around, I can add that information into the chat box for easy access, or of course, you can Google that information. Feel free again to email me directly, andrew.buck@osumc.edu. I'll enter that into the chat as well if you would like to hang out. And I just want to thank you all very much for taking the time to learn more about our work. And hopefully you were able to take something away that you can directly act upon to make sure that we're providing high quality services and doing the best that we can to make sure that we're keeping everyone in mind when we conduct research and being inclusive and making sure that we're including individuals with intellectual and developmental disabilities in our work.
Great. Well, thank you so much. This has been a wonderful session. We had quite a few people that joined today. And I appreciate that Christine was able to join us as well. I'm launching a poll right now for you to give us an evaluation. And if you could just take a couple minutes to fill this out, and we welcome any comments that you might have. And we hope that you enjoy the rest of your sessions today. If you have any technical difficulties, please feel free to reach out to me or anyone on our team, and we're happy to walk you through it. I'm going to leave this up for a few minutes so you have time to complete it. And thank you again for your time.